Hello, my name is Alex Bowie, and I'll be talking to you about universal healthcare. So I have worked in the ER as a tech for a little bit over 6 years, and I have seen some crazy things. But I think the story that stays with me the most, and that I'll never forget, is a patient who had came in. He was unconscious. He had been displaying stroke-like symptoms throughout the day. And this was, maybe about 2 in the morning. So he had been displaying stroke-like symptoms since the morning prior. And they decided that they were going to wait until, maybe he felt worse because they didn't have any health insurance. So they didn't want to come into the ER and, end up getting this large bill for maybe something that wasn't anything. So they waited it out. He went to sleep. The wife woke up in the middle of the night because he just was like comatose, would not move. She was trying to wake him up. He had urinated all over the bed. She finally called 911. And by the time he was brought into the ER, the CT scan showed that he had had a massive brain bleed. So it was irreversible. This man was going to be a vegetable for the rest of his life if they decided to keep him on life support. And I just will never forget speaking to that woman and just hearing the pain in her voice, knowing that maybe they could have brought him in earlier and, had some interventions and this would not have been his fate, but because they didn't have health insurance, they were scared to come into the ER. This leads me into saying that the US actually has the largest health disparity in the world, and this comes from data from the Commonwealth Fund. In 2010, the Affordable Care Act was passed, and it has made an incredible stride towards universal health care. Currently, it's been going back and forth between presidencies. Some people want to revoke it, but it's actually been very, very helpful to people. But I think we could do better than the Affordable Care Act. The WHO, the World Health Organization, defines universal healthcare as having the same access to healthcare despite financial stand. So currently the US health system actually works as a for-profit business, which basically means the better insurance you have, the better service you're going to get. Healthcare should not be a luxury. Universal healthcare would increase the health population, and it would prevent medical bankruptcy. The greatest advantage, arguably, is that it increases the overall health population by equating resources. So a lot of the communicable diseases, such as like type 2 diabetes, cardiovascular disease, obesity, is at an epidemic level. And unfortunately, it's more prevalent in low socioeconomic status populations because they don't have insurance. They don't have access to primary care physicians. And so they're using the ER as their primary care. And they do this because they have no other choice. If you didn't know, here in the US, the ER cannot turn you away, whether you have insurance or you don't. So that's why a lot of this population is kind of forced to just go to the ER and get what they need. Uninsured diabetics are actually responsible for 55% more ER visits than uninsured diabetics. And this overwhelms the ER, as you can imagine. Universal healthcare would allocate resources better, and they would alleviate the stress of the ER so that nurses and healthcare providers can actually tend to emergencies. This universal healthcare would also allow people to get earlier treatment because they'll have earlier diagnoses. They won't have to go, they won't have to wait until their disease has gone, has gotten really bad and they're in the ER. They could have regular visits. And because government would be financially responsible in a single payer insurance, they would most likely than not be incentivized to fund preventative programs. Another great thing about universal health care would be it would prevent medical bankruptcy. So kind of like my story, not kind of, but exactly like my story, the couple, wanted to wait off on going into the ER because they didn't have insurance and they didn't want to be stuck with a bill that they couldn't afford. According to the National Bankruptcy Forum, medical debt is actually the #1 reason for filing bankruptcy, which is pretty crazy when you think about it. As of today, if you compare hospital prices, it fluctuates tremendously depending on the facility and the type of coverage that you have. So for example, one of the studies that I referenced, uncomplicated normal vaginal birth varies 10 times across California, just California. And the discrepancies in fees doesn't correlate with better outcomes, which you might be thinking, okay, if I'm paying all this money, I'm guaranteed, a better outcome for me and my baby. But this study that took all these numbers and compared all the prices saw that that wasn't necessarily true. So then one thinks, well, then why is there such a discrepancy? And it's just because each insurance can basically charge whatever they want. It's whatever's covered in your insurance. It's whatever hospital, if it's public, if it's private, if they accept Medicare, there's so much that goes into it. And that's why they're able to kind of set their own price. Universal healthcare would fix this by fixing the rates, and they would cap it like, hey, okay, so vaginal birth costs this much all across the board. And then providers would get reimbursed the same amount for the same procedure, and patients would all have the same quality of care, just a win-win situation. The leading argument against universal health care is that the upfront costs just don't seem feasible. There's a lot of upfront costs, and so the critics say that it's not doable. But considering the advantages of universal health care, the cost will be compensated in the long run. We would save a lot more money doing it this way versus the way we're doing it now. I conclude this speech by asking you, the audience, to put yourself in the shoes of the family in the beginning of my story, to think about the agony of having to make a choice. Do I wait and see if my husband gets better? Or do I go in right away, and get life-saving care? No one should have to think about that. It should just be, we should have the right to just go into any facility and get the same care as the person next to you, no matter who you are, how much money you make. It's a human right, just like it says here on my slide. There is no price to put on someone's life. And if a single payer universal health care bill ever passes, I urge you to vote yes and think about this story next time you think about universal health care.